Care as One is committed to providing a unique virtual collaborative experience for healthcare professionals to come together to exchange information about U.S. healthcare through collaboration, conversation, and knowledge sharing. The Future of Health podcast provides a true infotainment service that helps the industry innovate by sharing expert voices, views, and advice on the important issues of the day. And now here's your host for The Future of Health, Dipti Desai.
Hello everyone. Welcome to the Future of Health with Care as One. I'm Dipti Desai, the Director of Care as One and the host for this podcast series. For those of you that are new to Care as One, it is a large virtual community that brings together various stakeholders in the care cycle, from providers to payers, pharma to clinical researchers, startups, investors, universities, and more. The mission of Care as One is truly to care as one by creating a connected healthcare community where the patient is at the center of care. The entire ecosystem comes together to care as one through knowledge sharing with the help of healthcare luminaries and thought leaders to discuss the challenges, gaps, solutions, and transformations essential to make healthcare whole again. The interaction and networking between the stakeholders is made possible through the community via summits, webinars, roundtables, leadership circles, and podcasts. In today's podcast episode, I will be talking to the Chief Experience Officer of Atrium Health and the Chief Human Resources Officer for Navicent Market of Atrium Health. They're one and the same. Vishal Bhalla. Vishal is an acclaimed national thought leader and has an incredible history of serving as a leader through diversity and inclusion by facilitating a culture of transparency and rapid innovation. His experience in healthcare spans over 7 years, and today he will be discussing siloed care and a need for integrated solutions. Vishal, it's truly an honor to host you. To begin with, can you please tell our listeners a little bit about yourself, your role at Atrium Health, and what you and your team focus on every day? Maybe you can also touch on the journey that brought you to where you are today. Vishal?
Thank you so much, Dipti, and it's really an honor to be here with Care as One, and I love the name of your organization. It is so reflective of what we need to do, not just in healthcare, but in general as human beings. My journey, I've been very blessed to have worked on 4 continents and truly understand diversity by being immersed in it. I started off in hospitality. Like many others in hospitality, I started off washing dishes and then moved into the culinary field. And then into cost control and then operations. I really enjoyed project management and openings. And so I would be part of the opening team that would go in, take over from the construction team, do massive recruitment, standard operating procedures, lots of training, operate the place, make sure it's performing financially well, and then hand over to the operating team and move on to the next project. So that was an amazing experience. That's what took me and my family. Thankfully, I have a very supportive family all over the world. And, the kids went to school in different parts of the world and learned different languages. So it was awesome. We were in St. Lucia, and I got a call from my mom from Canada saying, Dad's in the hospital and he won't be coming home most likely. So we kind of moved overnight to Canada. And I was, again, fortunate to get a job that you work 20 days on and 10 off. And I spent those 10 days in the hospital with him. It was, being a master black belt in lean and actually living from a healthcare provider perspective, patient care provider perspective, family care provider, not a professional healthcare provider perspective. That's when I really saw some of the opportunities, I guess, in healthcare. And I wasn't really paying too much attention. That's not your focus at that point in time. And they took great care of him, and knock on wood, right? Really grateful for all of that. But there were some unintended consequences of care that happen all the time in healthcare, I find now. And so I pushed my way gently but firmly up the chain of command to find out how something like this could have happened. And the answer I got from the COO was there was a lack of resources. And my response was, figuratively speaking, you have water running down the drain on this side and people dying of thirst on the other. And my dad passed on, not because of that, but he passed on peacefully, thankfully, incidentally today. And I was doing my MBA at the time. I was a little bit shook up off center, and I kept spinning on it. And my wife, who's also my best friend, said, do something about it or zip it. I've heard enough after some time. And so I really decided to serve in healthcare. My classmates were supremely supportive. A lot of them were from the field, and that's why I'm here today. Thanks to the entire community who supported me through this, starting from my wife, my kids who followed us into the United States in their sophomore year of and a senior. So it was interesting. The first job, so I also worked as a consultant a little bit for Philips and part of my MBA program at MIT. And the project morphed into helping evolve the culture. That was a great experience. I'm really grateful for that. Then my first job opportunity was with Parkland Hospital in Dallas. It's a safety net hospital system, the busiest ED in the country. And boy, I learned so much there.
Wow. I think that's when we met. That's when I knew you, when you were at Parkland. Yes. Yeah.
Yes, ma'am. And I started working in HR because that was my, I've always had HR roll up to me, even in my previous roles. For example, in my job in Canada, we had about, in the end, we had 13 properties and about 6,000 beds that we were caring for, all rolling up to me. And so HR always rolled up in various facets. But I was really, when I joined Parkland, I did a project for patient experience on the side, because that's what drove me to healthcare, is to make a difference in the life of the patients. And I found that, our people were hurting. They're really hurting much more than the patients. And if you can't, I always love giving the example of the flight attendant, when cabin pressure drops, put the mask on yourself.
Yeah. Help yourself before you help others.
We were figuratively, our team was gasping for breath when they're serving others. And so I really was, again, blessed to have a leader who understood my thought process and expanded my scope to be teammate experience, physician engagement, and patient experience, not just one or the other. And so we were able to make some strides in that organization. We went from the 75th percentile in the country to the 90th in patient experience.
That's good.
And and they've stayed there for over 14 quarters, I believe. So it's been an awesome learning journey. And then I had this opportunity recently, now 5 months old, at Atrium Health, to scale up the ability of influencing more lives. And so we're a larger organization. Now we're 42 hospitals and 1,500 clinics with over 72,000 teammates. And so I'm the first chief experience officer at Atrium Health. It's not that they did not have that as a focus. It has elevated to the point whereby they're willing to allocate resources and really do it meaningfully. And also I'm the chief of human resources for one of the markets.
Mm-hmm. That's amazing, Vishal. What an eventful and fulfilling journey. I mean, it really touched my heart, and it was a great pleasure to hear about your journey and everything that you've accomplished. And I know that you've mentioned in the past before that you're passionate about reducing this fragmentation you see in healthcare, right? Can you tell our viewers a little bit about what fragmentation is as it pertains to healthcare sector, and how will this or how does this fragmentation impact care?
Yeah. So from a patient perspective, I saw it as fragmented, right? Once I'm inside, I'm just seeing that everyone is really aligned, is really focused on caring for the patient, but they are, I would say, siloed. So there's more opportunity for alignment. That's how I would frame it. So let's say, and again, I'm going to look at it from both the patient perspective, the people we serve and people who serve. And you'll see me using these two groupings more frequently. So from the people we serve perspective, i.e. a patient, I'm a patient, I go to my family care physician who is in a group X, right? And he or she may refer me to an inpatient for some, or to a specialist to get something taken care of. The specialist may say, okay, you need to go get a small surgery, even if it's a day surgery, but it's in an inpatient hospital setting. And then you get discharged from there and you go back to your specialist, and then you go back to your family care. In between, you may or may not need to go to a recovery, rehab facility. Now, if that is the journey, at each point of transfer, there is friction, i.e. not a smooth experience for me as a patient. I may have to, something as simple as filling out the same form every time I go.
Mm-hmm. Yeah, I've done that.
Every single thing. Or it may be my bill, right? My invoice comes in, and 6 months after my actual operation, remember the day surgery I had in that sequence, as a person we care for, right? I'm still getting invoices from people I didn't even know I would have to pay, right? It's not one cohesive experience. And if I'm unhappy about something, it's not like Amazon where I get my money back. So the question is, why isn't it as seamless, right? I was filling in a form online for that same facility. I was actually a patient in a different location in Dallas, not at Parkland. And I filled out a form, and it asked me to fill in a date on my chart, I think it was, of that organization. I filled in the date. I filled in the date and said wrong format. So I tried again, said wrong. So I looked at it. I had to put in the forward slash, or was it backward slash? Like
Small
such
things like
simple
that.
things,
Small things like that.
to a very complex thing like billing, which you need to be able to estimate and plan for. And so I think it's extremely, from the patient perspective, and then from the provider perspective, I think everybody is very, very focused. I always say, what you measure, you can incentivize, and what you incentivize, you will receive, right? And so how we measure things and how we put systems and processes in place is more based on how the organization is in control. It's more organization centric rather than patient centric. So it's not just even organization centric, it's more department centric. So let me go back to your go to your family practice. It's all around when the doctor is available. Right now, we're seeing some technology, system, and process where you can self-schedule based on your availability and their availability. But your availability in the past was not even considered, right? As time goes, it's going to move, right? The power is shifting. The power balance is shifting to the individual consumer. It's no longer with the organization. And so we have to wake up and make sure, because our intention is honorable in healthcare.
Yes.
We want to serve the patient. We want to improve their health. That's why that's our moral purpose. The patient's moral purpose is the same. They want to get better. But somehow in the past, we have been very, because how we have evolved, we have become so much more complex, that we have built systems around our needs rather and forgotten that second half to some extent.
Yeah, I feel like it's all behind a thick glass, or it's like a red tape, right? And it's time and time again we see in all industries, we want that good customer experience. You brought to light the Amazon experience, but with healthcare we are still behind, as you alluded, in the patient scheduling and doctor visits. So when you talk about this red tape and the glass, what can be done to reduce the frustration encountered by the patient and the provider, because they both want a better experience?
Absolutely, absolutely, and thank you for reminding me of my analogy. So I always say there's a bird, which is the person who serves, right, and the bread is a patient, and the bird is trying to get to the bread, and we put this thick glass of red tape and stuff in the way, and the bird keeps beating its beak on the glass, and it bleeds and either flies away or dies. And so people join healthcare to serve, and patients come to healthcare to be taken care of. But there's so much regulation, and so much so that it's not just because of regulation, but there's so much of that stuff in the middle that, healthcare has the highest suicide rate of any industry, more than double the second.
And by this, you mean by the provider side, not the patient. I mean, patients are getting better and passing away, but the providers are the ones that are getting affected.
Yes, they're frustrated because they join for one reason, and then they're unable to fulfill their sense of purpose. So much so. And there are many studies on this, and it really breaks my heart, because here are people who are willing to give of themselves more than they can, and yet they keep giving of themselves. Emotionally, physically, they're stretched. Internally, they are hurting, but they still are out there to serve the other person before themselves. And I mean, that's just incredible. That motivation is incredible. And so it's so important that all of us align around them and really enable them. And so how do we do this, you asked, Dipti? How do we reduce that? Is by two things I say is, alignment and simplification. We complicate to the end of, you can't align and simplify everything. You can't oversimplify, because then you'll have, negative healthcare outcomes. You align and simplify so that you can enable the teammate, every care provider, to empower the patient. You see, you have to empower the patient for their wellness. And wellness is more than, a health company is more than a hospital, right? So in order for someone to be well, you have to really empower them with knowledge, with resources, connect them to the community, all that stuff. And in order to do that, if that's the end goal, is people live healthy, fulfilling lives, mentally, physically, and all that, we need to envelop them with our love factor. And in order to do that, we have to really enable our teammates. In order to enable them, we have to simplify what we do. Before we can simplify, we have to all align.
Powerful words. Simplify, align, and make it seamless for a better experience, right? I mean, it's truly remarkable.
Absolutely, ma'am.
And you mentioned that customer experience also. We were talking earlier, and you mentioned needs to be compassionate and memorable, right? And for that, like you mentioned just now, you need alignment from both the caregiver and the care receivers. So what is this compassionate, memorable experience? What, in your opinion, is needed to create this memorable, compassionate experience?
Yeah, that's the $1 million or $1 trillion nowadays question, I guess, right?
Yeah.
But I think that, again, I'll go back to the people who serve and people we serve, right? We know that internally the moral purpose of both is aligned. Okay, so if we make sure we're recruiting, and which is why I think having this role, Mr. Gene Woods and Jin Dunn, really, powerful thought leaders in enabling me to help facilitate this, is when you recruit the right people, that are aligned with the mission, right? And we enable them. So that's the people who serve. And then we're setting the right expectations for our patients. Mm-hmm. When people we serve interact with people who serve, okay, it has two kinds of outcomes. One is the clinical outcomes, mm-hmm. and the second is the outcomes of the hearts and minds.
Right.
Of both the people we serve and people who serve. Yeah. So the clinical outcome is not only important for the patient, it's also important for the care provider, because remember, it drives them, right? It hurts them when that doesn't happen. When a patient doesn't listen or doesn't come to the appointment, it really impacts the care provider too, right? So when those two interact, it creates those two outcomes, the clinical outcomes and the hearts and minds outcome. Okay. And there's a lot of studies that show the two are interrelated. When the heart and mind is positive, you have positive clinical outcomes, right?
True.
I'll give an example. Teammate. Yes. When there's high teammate engagement. So if you look at, this is from Gallup, when you look at the top quartile of engaged teams in healthcare in the United States, and you compare them to the bottom quartile of healthcare teams in the United States who are least engaged, right? So you look at the safety outcomes, there's a 40% difference. So I think it was 48, but I'm trying to go by memory here. So the hearts and minds, same thing with patients, right? There are so many studies that show when the patient is positive and in a good frame of mind, the clinical outcomes are the same. And when the clinical outcomes are positive, so you're in a positive cycle or a negative cycle, right? So we need to ensure that we are recruiting appropriately and setting the right expectations, enabling the physical, emotional, and social interaction.
Right.
By systems, processes, technology, right? Those are the three facets. Yeah. The physical, the social, and the emotional. Connect them. Let them interact, because they're both. Let them interact. Don't get in the way. Help remove those friction points. Yes. By process, technology, and people, or people first, of course, right? And let them interact to create these two outcomes. Now, as a organization, all this is on the backdrop of culture. So our values and our culture is the playground, if you will, how you can influence these. You cannot tell them. They're like teenagers, right? I have a 19-year-old and 21-year-old. I can hope to influence.
Yeah.
I cannot dictate. Yeah. So we have to make sure that we make that interaction positive, so that the two outcomes are positive. And if one is negative, let's say a clinical outcome is negative or not heading in the right way, we need to thoughtfully enable them to deal with it, cope with it, and support them through it. And so that on the backdrop of culture, I'll give you one more example, right? And I'm so on the high about the organization I work for, Atrium Health. So I think in terms of the teammate engagement, I talked about that briefly, right? It's no longer, I'm a teammate, okay? You're my boss, or you're the organization. It's no longer enough for you to care about my engagement at work. It's not even enough for you to care about my engagement with my professional aspirations. I need you to care for me, full stop. And so what Atrium Health has done is I was going to say they, but I'm part of them now. We have invested very thoughtfully and meaningfully with our love factor. I call this the love factor. So when life happens to a teammate, we're there to help them with it, whatever it may be, right? And so I think that more and more organizations will start doing that in a holistic approach, not just, okay, we have go do some education and we'll pay for it. That's okay, but I need someone to be there for me throughout my life journey. And so you will see that there are going to be two, I know I'm digressing, but I think it all feeds into this. People we serve and people who serve. The people we serve, especially in healthcare, are falling into two big buckets. One is the gig economy, And the other is people who really want to engage with the organization and be there long term, understand your perspectives, your values, and want to align with that. The gig economy people are like, what's my hourly rate? Thank you very much. That's my focus. And I'm here today, gone tomorrow, gig economy, right? And they want the benefits plan, which is a cafeteria plan. I'll select these benefits or pay me that money instead, right? But the long-term teammates are those who really look about what I was talking
What
about,
can I
right?
make?
The
How can I
whole
make
love factor. And so,
impact? Yeah, yeah.
absolutely. And they want the ability to switch between those two buckets, depending upon where they're in life. So it's very important for us as an organization to ensure that, remember, whether they are group 1 or group 2, they are people who serve.
Yes, yes.
They may also become our patients or vice versa.
Right.
And we have to make sure that they are emotionally and physically and financially in the right state when they interact with people who serve. People who serve.
True.
So with people we serve to come up with those interactions.
And
So I think that's the big picture.
You're right. And this country has gone through so much with the pandemic, the ups and downs, the depression rates, not only in healthcare, other industries too have been very high. And you really need to understand that person and see where they're coming from and make sure that they're aligned with your mission and that they can fulfill the task that, you've set them out for. And the pandemic was also instrumental in exposing the deficiencies that we see in healthcare today, especially one of talent. Talent shortage is huge, right? I mean, being the chief experience officer in HR, an HR officer too, what do you see from your vantage point? Where do you see this? And do you see a solution for this shortage that we are seeing today?
Yes. Again, very deep question. So I think that COVID has sped up stuff that was already bubbling beneath the surface. It has just brought it to the surface faster, right? I always say it's the chicken and the egg, right? Is your customer more important or is your teammate? So I would like you to, if you're listening, I'd like you to really take a deep breath and think, you have 2 kids. One is the customer and one is the teammate. Or look at it from, the chicken and the egg, what comes first? Of course, the egg comes first in this case, the teammate. Without teammates, you don't have customers, right? So the flip side is, ask yourself the question, are you spending the same amount of time, resources, money, efforts, people, process, technology, time in your boardroom, time that your frontline leader is working on both of them equally or not? Whether it's your internal customer or your external customer, So I think most organizations would do good by reflecting on that. And so what's happened is, on comes COVID, right? And so people have reevaluated. I have reevaluated. Maybe Dipti, you have too, I think, is what's most important to me in life. COVID has made us think about that and maybe change our priorities, not necessarily the priorities themselves, but even the rating of the weightage of what was more important than the other between, making money, spending time with family, and checking things off my bucket list, right? So funny story is we have this bottle of champagne that I bought before I got married. It's a bottle of Dom. We said, okay, we're going to open it when we get married. And we said, let's save it for when our son is born. Let's wait till he's 1 year old. Then our daughter is going to be born. It's still not open yet, right? And it's in my mom's house. So we're going to go to Canada just to open the bottle of champagne because we can't wait anymore. And it's not going to be any special occasion. The occasion will be opening that bottle. So we've changed how we think about life, about what's most important. So has everybody else. So what they've said is, enough is enough, okay? See me for who I am. You saw this whole social injustice stuff. Like, take me as I am. Secondly, my time is most important. So I'm not going to spend a lot of time making money. So a lot of people are not taking overtime. So you see, even the other day, one of the Chick-fil-A's down the street was closed. Not enough staff, right? The other thing is, because I'm not spending enough time making money, every dollar has more value. And so when you put those together, from both the teammate perspective, people who we serve and people who serve perspective, the what I want, when I want, where I want, see me for who I am, that has gained even more importance. And so power has really shifted to the individual level, and they are holding us, the organizations, accountable. Individuals are holding the organization accountable. So what do we need to do? You asked from a teammate perspective. I'm coming to it. We have to change our perspective from us to being customer-centric, in this case, candidate-centric or teammate-centric. We have to be able to serve them. Our systems and processes were aligned around ourselves, and I'll give you one example. In talent acquisition, the metric that talent acquisition is held accountable to is time to fill. From the time the position is made is vacant to the time the position is filled. That's now. How does that apply? If you're applying for a job, does that have any meaning for you as an individual? For when the department opened a position to the position filled? Not really, right? You're concerned about when did you apply to the time you got the job offer. Guess what? We never measured it. We don't measure the time from a time a candidate applies to the time the candidate gets offered. We just started measuring it. What you measure, you can incentivize. What you incentivize, you will receive. And we did that as a pilot for just our housekeeping, EVS, we call it in healthcare, right? For our frontline teammates as a pilot. We changed our metrics. We had to change our systems. We had to change our process, how we did it, right? Because it's focused on, and this forced us. Because we didn't have enough teammates, we had to rethink, okay, what are we doing? And how do we become more customer-centric? Because whether someone applies for a job at McDonald's or to us, if we're paying $12, $13, $14 an hour, it's the same. It's not the candidate's problem that we have to have them do a TB test and blah, blah, blah. It's our issue to solve. So we did that, and we went from, I think it was 13 days an average historically from a time a candidate applied to the time they got the job offer. And I'm proud to say in the last 2 months, 97% of those teammates for that position have got it in 24 hours.
Wow. That is a big.
From the time they applied to the time they got a job offer. So what do we need to do as organizations is respect the individual as an individual, care for them, period. Not at work, not just for professional aspirations, but really care for them. And fundamentally, we need to shift our thinking to be more customer-centric.
Yeah. And it looks like you were able to do this because you changed the processes. You probably used some form of technology, or you used somehow to measure and analyze this process. And if you did that for everything that you need to, you would be able to now bring about a quantitative change in all the processes that you carry out. So I know that Atrium Health seeks to improve health, elevate hope, and advance healing for all. I read this on your website and I was thinking, wow, that's a really good tagline. Care as One has very similar goals. Any thoughts on how we can provide care for all in a unified manner? I mean, how can we truly care as one? Your thoughts?
So remember when I talked about the model of people we serve with people who serve, right? And it has those outcomes, clinical, emotional, and they're aligned. It's all in the backdrop of our culture. And the culture is the expression of our values, right? So it's very, very important, I think, as an organization to be very articulate or very clear about our values, use them in our value proposition and brand image, not just, I don't want to say use them, but make sure we are expressing them in our brand image, not just for our consumers, but also for our candidates, teammates. So our brand image has to be one, and we have to really live through those values.
That's true.
We have to evaluate them, ensure that we as an organization agree with it, and embed them in our daily operations, in our life, and how we live by them. So we articulate them, we recruit to them, we promote to them, that's how we live. That's how things work around here. That's how it should be all the time.
Internalize this whole care as one and kind of follow it every day in everything that we do. So I know this was a really an amazing hour that we spent. I know we discussed a lot of different things today, but there must be still some challenges that you may have faced that we may not have discussed. Would you like to bring up anything and share with our audience over here? Anything that comes to mind?
Well, I do think that technology can definitely help streamline, simplify and align, and also escalate any points of high friction. And so I think there are some great opportunities in possibly data mining from live operations to do that, and overlaying that with the experience at the same time. I think that is definitely a future, and then you add AI and ML on it, and then that can help direct. And I'll give you an example of possibility. And this is just a dream.
I know.
I'm just dreaming.
We're all thinking about what
Fantasy
we
world.
do.
So let's say you have 5 clinics with waiting rooms in each of the clinics, and for ease of this calculation, each of those 5 clinics has 10 chairs and 2 staff members on the waiting rooms, right? So when you go in, you register. And so one clinic has 8 people that show up. One clinic has 2 people. One clinic has an overflow, right? So if we had this live monitoring system, it would automatically tell someone from the clinic which has only 2 patients waiting to go and help out in the clinic which has 12 patients waiting. Part 1. Part 2, it would learn in the future and make sure that you're pacing out your scheduling better, because that may be a different specialty or whatever the case may be. Right now, I think, and that's where I think we're siloed in healthcare is to learn continuously across and share those learnings almost as live as we can, which happens in other industries, right? And so it can happen in healthcare, right? You try to book a ticket on one day, and then you try to book the same ticket on another day. There is an optimization software in the background that's running that. And so I think there is a lot of opportunity in healthcare around that from a interaction of people we serve with the people who serve perspective.
Truly, truly. If we were able to get these silos away and to integrate all of the data and bring it all together, there's miracles that you could do and transform healthcare through technology. And it's great parting words from you, Vishal. Thank you very much for taking the time to chat with us today and sharing your knowledge on siloed care and this need for integrated solutions. It has been very eye-opening experience, at least for me, and I'm sure for many of our listeners too. To the audience that we have with us today, thank you for listening. Don't forget to check the show notes for links to resources and contact information related to today's show. And stay tuned for more Care is One podcasts and discussions on trending healthcare topics that you care about. Send in your suggestions on speakers and topics that you would like to see more of, and we will try to address them. If you wish to join our Care is One community, you can sign up at community.careisone.org to post your thoughts and network with peers and talk to luminaries like Vishal over here. Thank you all. I'm Dipti Desai, and I hope you have a great rest of the day.